You are now listening to Extracting Wisdom. Here to help you prevent the decay of your future is your host, Brandon Everett.
Welcome back to Extracting Wisdom, the podcast that helps you prevent the decay of your future. I am your host, Brandon Everett, and tonight we have on two great friends of mine who are also in my dental class. I'm very grateful to be able to go through dental school with these guys. Not only are they great students, they are also great friends. And no matter the day in and day out, every single day, we always find ourselves laughing at something, which just goes to prove that you can have fun while you're going through dental school. So first, I would really like to introduce Mr. Seth Breaker. He's been on the show before. Seth, thanks for being on the show. How are you doing tonight?
Good. I'm glad to be back on.
Good to have you. And tonight we also have on another classmate, Mr. Kyle Boonyong, another fellow D2 student who I've been close with, just like Seth, since our orientation week when we took our cruise together as a class. And, I've really been wanting to have him on the show, but man, it's hard to align schedules when you're in dental school and trying to balance everything. But without further ado, Kyle, what's going on, my man? Thanks for being on the show.
It's going great, Brandon. Thank you for having me.
Absolutely. So let's get into this a little bit. So about 3 or 4 episodes ago, I had Seth on and we kind of talked about how his transition was from undergrad into his first year of dental school. And we kind of talked about some advice he had and just kind of his experience going through D1. So I kind of wanted to ask you kind of the same situation. How was your transition from undergrad into dental school? What was that like? And just kind of overall, how did your first year go for you in dental school?
I must say it was kind of tough. It was a hard transition. Just coming from undergrad, I went to Marquette University, and Marquette was a great school, and they prepared me pretty well. But dental school is a different beast. It's just a lot of information that's coming at you, and you always have to be on top of your game. So it's definitely been a challenge, and I definitely think I've came up to the feat. One advice I would give to all dental students is just be organized and kind of keep it one day at a time. Definitely don't want to overwhelm yourself, but keep organized, keep going after it. And that's what I've been doing D1 year. I think I've been fairly okay, been passing, been doing pretty well, and nothing too crazy.
Well, that's great. I have to say Kyle is probably one of the most organized students I know. I'm always looking over, and he has every single day he has this running Word document of notes to himself and what he wants to accomplish that day, and just he lays out his day and whatever other notes he has to put in there. But that really is the key to success. What Kyle just said is being organized, because dental school, you really don't have time to procrastinate, and there's a lot of information being thrown at you. And the best way to tackle that is to be able to have an organized system, whatever that may be. It may be Word documents like Kyle, it may be kind of flashcards for me, and it may be another method for Seth. But the fact of the matter is you want to have that organization. You want to have that routine. So do you feel like having a routine is important in dental school, Kyle?
I would say so. Definitely having a routine. I know you, Brandon, you work out in the morning. I don't think I could do that, but definitely that was a good way to kind of establish your day. It's a good booster, but I try to work out every day. Always at like 5 o'clock, 6 o'clock. So there's always a routine to it. And you mentioned that I have a to-do list, and it's pretty extensive. It goes from today to 2 weeks advance, just labeling the hours of the day, not per se the hours of the days, but just classes, blocking out the classes, blocking out the free times, and what I'm planning on doing in the free times. And it's really been helpful kind of just organizing what I want to do then, what I want to do in the future, and kind of, going by the routine, going through the motions day in, day out, kind of going in and day out, essentially.
Yeah, dental school's a grind, but and just like what you said, what may work for one person, I'm a crazy, people might call me crazy. I wake up early and I work out and stuff like that, but what may work for me might work for you. And I think that's super important, because I talk about daily routines a lot, and I personally talk about my routine, which is, more focused on early in the morning and that kind of thing. But honestly, whatever routine, as long as you have one, works. If you're more of a kind of a night owl and you like to stay up later and you'd rather work out after class, or, stay up later and study, that's totally up to you about it. But what I'm trying to say is just having a routine that you can stick to, that's comfortable for you, and something that you can accomplish day in and day out is really going to be beneficial. You know what I mean?
Most definitely. Most definitely.
So well, that's a great tip right off the bat. So what were your thoughts on D1 year? You're now a D2 year. You're still living. You're still breathing. Congratulations. we're all here.
I hope so.
Yeah, I know. We'll see after D2 year. I don't know. But how did D1 year go for you? What were some of your thoughts? What did you like about it? What did you dislike about it?
Let's think. D1 year, I really like the waxing component. I really enjoy that for some reason. I know it's kind of an extinct kind of lab skill that most people don't really enjoy per se, because you won't ever do that in private practice. But I kind of enjoyed waxing. That was pretty fun, kind of beginner level hand skill kind of thing, seeing tooth anatomy, using your hands. So I thought that was really enjoyable for D1 year. Besides that, anatomy was pretty cool. Just going, I'd never been to the cadaver lab before in undergrad. So seeing the cadaver lab in a graduate school setting was pretty intense and pretty scary at first, but definitely pretty cool to see. So I think waxing and anatomy lab were probably the highlights of D1 year. And yeah, I think that's pretty cool.
Still wish you were in anatomy?
No, a friend of ours keeps on joking that anatomy is kind of one of my favorite subjects, and I kind of wish a little bit.
Okay, all right.
But yeah, absolutely. And it's such a new kind of thing, regardless if you took anatomy in your undergrad courses, because the majority of kind of undergrad anatomy courses, you're not really doing the dissecting, and it becomes a lot more personal and a lot more kind of educational, I think, when you're the ones that are actually doing the dissections, which is just, it's really something special to be able to kind of explore the human body like that. Which is very cool, very stressful at the same time. Obviously, it's a very complex system, but yeah, yes. I agree. That was a highlight too. But I'm definitely glad to be done with it as well. So
yeah.
What did you find maybe the hardest about D1 year? What would you say is something maybe not you struggled with, but maybe something that you didn't necessarily think about when you were entering D1 year, or something that you found just more difficult in general?
It's kind of different because dental school, you compile a bunch of different people that we always talk about this type A personalities, and kind of meshing with people and kind of like seeing where everything is. It's kind of hard. That's the struggle that I kind of had happen at the beginning, just comparing yourself. I know at the beginning of dental school, like everyone's like looking at each other and like looking left and right and kind of seeing where you're at amongst each other. And it's kind of tough in that sense. Like you always were in undergrad, like as a pre-dental student, you're always typically on top of your class or succeeding, and you're like, that's awesome. But in dental school, it kind of puts you in your place. And that was a real struggle for me personally, just saying, okay, dang, this guy's really smart. Like, or like when they say in information in class, it's like, oh, am I supposed to know that? Like, oh, I didn't even know that yet. And like, it was kind of crazy just to kind of see what other people say and how brilliant they are, and how to kind of relieve that problem was kind of just like, just do you, man, do you. In a sense, you don't have to worry about what other people do. You just you're building yourself slowly but surely to whatever goal that you set in mind. So that's kind of how I kind of solved that problem.
Yeah, I would agree with that. I mean, I think I had a similar situation with that. I mean, it's just kind of, you come from undergrad where you're just trying to get the A's. That's what's so important too. You just want to get, the highest grade, and you keep comparing yourself against everybody else, on grade wise. But in dental school, you kind of have to have a mind shift change, and you have to realize you're trying to learn. Learning is the most important thing. It's not about getting the A. It's just if you got, I mean, I think that was one of the hardest things for me too. It's just also just comparing myself and just trying to the grades, and it's not all about the grades. It's not about being the smartest in your class. It's just about learning.
Exactly.
And I'm really glad you guys brought that up, actually, because, and I really wasn't intending to talk about this, but this is something that I really haven't talked about too much on the podcast. But I would totally agree with you guys that comparing yourself to others is such a, like, it's dangerous. It's sometimes, because, you know, everybody has different backgrounds and different experiences. And you might see one student that might have like amazing hand skills, right? And you're like, wow, why can't I be like that? But that same student might be struggling in lecture or with the kind of more didactic sessions. So it's important to really keep yourself in check and understand that everybody's going to have their strengths. Everybody's going to have their weaknesses. And especially like we're going through dental school, and all of us are doing these things for the very first time, right? So like just today we were making our very first temporary crowns. Okay. And you can't expect for the very first time, I mean, you can have a good outcome, but you can't expect for the very first time for you to have, you know, A+ crowns, you know, and obviously we're all striving for that. And maybe some students will do that, but you know, it's all a learning process. And at the end of the day, after our 4 years of dental school, we're all going to be on that level playing field. You know, it's just different rates of learning, and different rates of hand skills, and everybody has strengths and weaknesses, but it's important to realize, don't compare yourself to others. Compare yourself to you. Really, it's not a matter of outcompeting your classmates, but it's more about learning from your classmates and trying to outcompete yourself.
Yes, I definitely agree with that. It's tough. Like, even mentioned the provisionals, I didn't even finish my provisional today. I was looking left and I was like, dang, these are beautiful. Like, people are like knocking these out like they've been doing it for like years and years. Like, man, it's only been one provisional, and just like flustering myself. I struggle with still. It's definitely still a struggle, but definitely something that all dental students, pre-dental students have to consider. Just have to keep to yourself and kind of build your own skill. Everyone can be on different levels, like Brandon.
So funny story about the provisionals today. I know, Kyle, you know a little bit about this, but Seth, you probably don't. So we started our provisionals today. Okay, everything's going great. I have such a good seal on my margin, and everything's looking great. And so I just need to put the finishing touches on it. I just need to smooth it out, maybe do a little bit more occlusal anatomy, and I'm going to put that sucker on and call it a day. Well, as I'm holding my crown and I'm finishing, my crown goes, "Ooh!" and just goes across the room, and it's gone. I can't find it. It blends in with the floor. It's that white tile, and it's gone. So I'm sitting there, and I'm like, I literally just wasted like half an hour trying to get this damn crown or this damn provisional up to speed, and everything looked great. And now I lost it. So,
were you polishing it?
Yeah, I was just finishing. Well, I wasn't polishing it, but I was like using some nice finishing burrs to get it nice and smooth.
Yeah.
Before I polished it, I was so close to finishing it, and I lost it. And so I'm saying, I had a little moment, and and
you should have seen him. He's moving the garbage cans, like looking all over the place. We're just like trying to mad find this provisional. Like, where could it be?
I know. And so I gave up. I gave up looking for it, and I was like, you know what, I'm just gonna start a second crown. Well, Kyle, I think you left before the second part of this story. So
okay, yes, I
did. So I'm finishing up this second crown. And a couple of guys that live in the same apartment complex helped me look for my crown, because there was just a couple of us left in the lab. There was less people. It's easier to look. And Holden was, of all people, he comes, he works in the unit next to me, and he comes and he's like, "Brandon, I found your crown." It was literally right under my chair the entire time I was looking for it, but it blended into the floor. I couldn't even see it. So I said some things I probably shouldn't have. I was so mad, guys. But yeah, whatever. I got an extra rep in there, but
yeah.
Sorry, that was a tangent. But back to what we're talking about here, like comparing yourself. Like, just don't compare yourself to others. Like, work as hard as you can to be the best clinician that you can be. I mean, this day and age, when you're comparing, you know, student to student, and you know, you have students posting their best work on Instagram and all that stuff, it's just important to realize that, like, you know, everybody's running their own race, you know, and that's important to keep in mind, especially, you know, whether you're a pre-dental student, D1, D2, and any dental student, really. It's just so important. It's important for your learning while you're going through school, and it's important, like, even mentally too. Like, you don't want to have that stigma, like, oh, I need to do better than so and so or whatever. It's about improving and doing the best that you can do.
Yeah, there's a quote I like. it says, don't compare yourself against like others, but compare yourself against yourself yesterday. So it's just, you need to not try to constantly look at others, like you just said, and be in competition, but try to build yourself day to day and look at yourself from yesterday and see what you can critique and work on today. And I think it's just, I think that's the best mindset it's hard to have, but I think it's just like the best, most healthy mindset to kind of have.
Yeah, I love that. That's a great quote, and it's so true too. So Kyle, and I guess Seth too. So we've made it through D1 year, and pretty much the name of the game of D1 year is being able to manage all the material that's thrown at you. It's heavily kind of based on lectures. There's a lot of kind of the basic sciences of both just, regular biochemical and, cellular biology and all that stuff, as well as kind of the basic sciences behind dentistry. And we've made it through that, which is good. And this is to, whoever wants to speak first, but how do you think D2 year now compares to D1 year? Do you find it easier, harder, and kind of what do you like about it and what do you not like about it?
I could start off. Well, definitely the weather is definitely more beautiful. It's kind of uplifting in that sense. For D1 year, it was kind kind of the winter time and fall time. So it was like a little depressing and like stuck in time, just lecture, anatomy. But now it's the course is a little bit lighter. We have, I don't know if you guys know the context, but we have a DOB course and DBCS course. Similar to last semester, but they have a lot less daily work that we have to do, a lot less quizzes, and exams are pretty heavy, but we could always study and build up to that point, but not less of the daily work. And so it's a lot more free time for us to kind of explore what we like to do, and so forth. So it's a lot more relaxed in a sense, and it's nice. It's nice in that regards.
Yeah. D2 year is much more clinically related. The information we're learning is much more, you need to know. It's not like just the core sciences, which I enjoy a lot more. And also you have a lot more clinic time too. And you get time to perfect your hand skills, and those are the things, as anyone going into dentistry really enjoys. That's why you become a dentist usually, is because you want a job where you're going to be working with your hands and making pieces of art, like these crowns and these provisions that we even did today. So I think it's just a much more rewarding semester, I feel like.
Yeah, absolutely. I would agree with all that. I love this, this time of year, which is excellent. But I do have a couple things I want to bring up too that, I've been finding kind of hard. First thing, and even though this is awesome, like we're in a fixed pros course, we're in a pediatric course, we're in operative dentistry, or in perio, and we're learning all of these procedures, right? And I love it. Like I'm starting to feel like a real dentist now that we're learning how to do crowns and learning how to do perio and learning, some pediatric procedures and stuff like that. Hard part for me is that we're learning so many new procedures, and like every day we're doing something different, right? So like I feel like the first time I do a procedure, it's either like I'm good at it or like I absolutely just suck at it. You know what I mean? And it's hard to keep in mind that like, like this is the first time we're doing this procedure. Like you can't expect to be A+ work every single time, even though this is like our first time doing this procedure. I don't know if you guys have kind of felt something similar like that. It's just like last semester we kind of focused on composites, and every week we're doing a composite, and you could see yourself, progressing as the weeks went on. But now it's almost like we're doing something totally different every week. Like you're not necessarily seeing that progression because we're doing different things, pretty much every day. So that's something that like, I don't know, I've had to kind of mentally understand, because I'm like, oh my gosh, like I just like, this was not A+ work, I must suck as a dentist. But it's like, no, like these are the first times we're learning these procedures, right? And so that's just important to keep in mind. And just I'll throw this out there too, and then you guys can take it away if you guys want to respond to that. But like year-round schooling, this is the first time I have ever gone to school year-round. and I love being in school. I love being in a routine, but man, it's a grind. And I feel like the last week I've really like slowed down. Like I haven't worked out as much, usually I'm up at 5 a.m. 5 days a week, but I've been sleeping in more and more. And I think it's just because, again, like burnout is something that's so real in dental school. And like, you really need to not only like take care of your grades and take care of your studying and all that, but you got to take care of yourself too. Like you can't be burning the candle at both ends 24/7, right? You got to make sure you take some time to, take a week or two. And I've said this before on the show too, is if, when you start feeling yourself kind of, there's ebbs and flows, right, throughout dental school. So whenever you start kind of in that downward, trend, you really got to kind of take a step back and relax for a little bit. Just for your own sake and for your own body and for your own mind. But yeah, those are just some things I've kind of, thought about throughout this summer term.
Yeah, I definitely agree. I'll speak to your second point first. Yeah, burnout is real. And what I tell myself, and one of the quotes that I kind of live by, is that you are the biggest asset to yourself. Like you are the biggest asset, your body, your eyes, your hands, and so forth. You got to take care of it, and your mind, as you mentioned, Brandon.
Right.
So you got to really take care of yourself. I know we've been grinding, busting our tails off, and trying to work towards our goals and so forth, and kind of keep up with the information. Even though we mentioned it's kind of more relaxed, but you said as the first part, it's a lot more frustration with these clinical hand skills, building it up. But you got to take care of yourself for sure. And that's what I've been trying to focus on this D2 year for myself, just kind of take care of myself. As I mentioned that quote, you're the biggest asset. If your back's hurting later on, that's kind of on you. It's tough. I always see my classmates, they're always like hunching over, and I always try to tell them, like, all right, straighten out your back, try to keep everything all straight, everything all good. Like, we got to take care of each other too. So that's kind of a important thing. Just take care of your body, and so forth. So that was the second point, but I don't know if you guys want to add anything on the second point, but.
Yeah, I mean, I totally agree. I mean, I agree with everything was just said. You need to take time for yourself. And I think that the hard thing about dental school too is if you don't have routine, it's going to be much harder to, I guess, to be in a good place. Or I feel like dental school is much more stressful if you're going from cramming for exam and then the next week just being just totally wiped because you're cramming so hard for that exam.
Mm-hmm.
And then the next series of exams are going to come up and sneak up on you again, and then you're going to be in that situation again. And I mean, that's an unhealthy way to be. And I feel like I did that a little bit for the first semester. I think I kind of came in from undergrad knowing I was able to cram for exams and get A's and it'd be fine. But in dental school, you can't do that. I mean, it's going to take a toll on you in more ways than one. And so, yeah, routine is a great thing. And it also is just, it's kind of necessary. But yeah, I mean, at least this semester, I do agree. I mean, at least this semester, there's a little more freedom. I feel like there's been a little more time to take for just have a little fun and blow off some steam. So that's been good.
Yeah, I definitely agree. And dental school is a marathon, not a sprint, right? So you really have to keep that in mind, especially like when you're starting off D1 year, D2 year. You really got to make sure that the pace that you're going through dental school and kind of the pace at which you push yourself or how much you push yourself is sustainable, right? And sometimes I find that, I got the podcast and I got dental school, of course, and I got some other things going on. And everybody has other things going on, whether that's relationships or, friends, family, whatever it is. It's sometimes it's too much and you find yourself like, I really do need to take a step back and take a deep breath, because really dental school is tough. It's a lot, whether you're thriving in it or whether you're not doing so well in it, regardless, it's a lot to go through, and it's stressful and it's a lot to learn. And even though we all love it, it takes a toll on us too. So it's really important to, take care of ourselves, like you said. Yeah, absolutely. So what else during, I guess, second year is different from D1 year? What are some other things? But let's talk about non-clinic, like lectures and like pathology and stuff. How has that been for you guys?
So, so we have a new course, DBCS, who's taught by Dr. Maloro. It's kind of funny. We only have one professor this semester who teaches. We have pathology and we have SGL still. So SGL is kind of the same what we have in D1 year. But Dr. Maloro only teaches pathology, while in last semester, we had multiple different teachers teaching different aspects of the course in DBCS. But pathology is interesting. It kind of incorporates all the stuff we learned last semester. Like, it just throws it all there. Like, everything in pathology, like, incorporate different pieces of fragments from this part of the semester, like the very beginning, or this part of first semester. Like, you're just kind of integrating all different concepts that you learned the first semester to DBCS, which is interesting and kind of hard because you kind of like, oh, I remember that, but not really. And it's tough in that regards.
Yeah, I think it's pretty, it can be really satisfying because it's kind of neat when you actually make these connections between different diseases and different infections and how they actually manifest, and how it's really cool when it clicks. It can also be very frustrating too, because you're like trying to recall something you talked about in a lecture, weeks ago, months ago. And sometimes it can be really frustrating because you're like, oh, I should remember this. But yeah, it's been good.
Yeah, I'm kind of in the same boat. I really like pathology. It's a lot to get through. There's so many slides. I think on average, how many slides we have? Like 200 or something like that every single time. And it's like a 3-hour lecture and it's tough to get through. But I think we really are learning a lot. Finally, this is really the kind of the application of all the kind of sciences we learned last year to kind of the pathology and all the mechanisms behind it, and kind of the medications that treat it, and so on and so forth. But one thing I want to kind of take a second to mention is, I have a friend in med school, and I was telling him, he was asking me what kind of classes we were taking. I was like, oh, we're taking, cardiac path right now. And, he's like, well, why are you guys taking that? You guys are dentists. And kind of as we've discovered going through lectures and our small group learning, and where we have these cases that integrate everything, is that dentistry is so much more involved than just the mouth and the teeth. It really is, because there's so many diseases and bacteria that are in the mouth that can spread systemically to different areas and have that origin within the mouth. And there's medications that we need to prescribe that could have potential interactions with other other medications that this patient is on because they have a certain condition or disease. So there's a lot really that we need to be able to know besides just the mouth and teeth, like people would think. There's so much more to dentistry than just that.
Yeah, it's definitely a lot that's going on systemically that's related to the oral cavity, and it's definitely interesting, these cases that they bring up. And like in the previous case, there's infective endocarditis, how any oral surgery that you do in a dental treatment can affect your heart, that most people won't think about. Like, as a pre-dental, I was like, whoa, I never thought about this, how just like extraction or scaling and root planing, these treatments that you do as a dentist would affect your heart and so forth. So it's interesting, and it's definitely tough. It kind of makes our job a little bit harder to kind of, as an oral healthcare provider and a systemic provider, we have to take care of this patient and so forth. So we definitely have to step up to the task.
And if with our vasoconstrictors and different local anesthetics that we use, it's important that we know what we're dealing with and how it can affect, like you just said, basically we're just saying how it can affect the whole body. And plus, if you think about it, we have patients coming in and we carry the name doctor, so we should have an idea and understanding the whole body.
Bingo.
And they
absolutely
they put their they trust us, and if something happens, we need to know what to do in order to help. So
yeah, and I totally agree with that. If you're going to have that DR in front of your name and either a MD or DMD or DDS or whatever it is behind your name, like if you're in any sort of healthcare profession, like you have to have some knowledge of the entire body and how it functions and how different diseases can manifest, and a basic understanding of pharmacology. Now, we're not going to be experts in everything, but
Right.
we need to understand when to refer, when something is dangerous, when there's something benign. There's so much that we have to consider before we carry out, our specialty, which is dentistry on the mouth and teeth. Like, we need to understand kind of the patient's, medical history, dental history, in order to kind of tailor our treatments to them, to have a safe prognosis or safe outcome.
Exactly. Like, I don't know, like, I'm being candid about this, but like, we learn so much information that, to be honest, we may not remember exactly about the biochemistry and about all these little mechanisms and stuff. Or specifically, we're focused on the oral cavity, but knowing just brief ideas, when to refer, when to know when there's going to be a problem is going to save patients' lives in the future when we refer them to cardiologists or different specialties that we can connect them to. So it's definitely going to help them in the future.
Right. And so just to kind of tie this together. So D1 year, kind of what we've been talking about in D2 year, but D1 year is more about kind of building yourself a solid foundation and starting to learn kind of the basic hand skills, wax ups and those kind of things, and dental anatomy. So that's your foundation. And arguably, from what I've heard, that's kind of your hardest year academically. Would you agree that last year was harder than this year academically, or like lecture wise?
Yeah.
Okay.
I would agree.
And that seems to be across the board in many dental schools. So now that we have this foundation, we're building on it now. So we're using the hand skills that we've sort of developed last year to now apply to, pretty much a new procedure almost every single day. Different types of crown preps and pediatric, restorations, and as well as pediatric stainless steel crowns and different perio, procedures that we're learning. And I don't know about you guys, but I have to say, like, after doing all of these different things, my indirect vision has gotten so much better. Like, I'm almost to the point where, like, I feel pretty comfortable doing everything in the mirror. Like, would you guys agree with that? Like, have you noticed an improvement since we've been doing all this stuff?
Yeah, I would agree. Yeah. I mean, I think the one thing that kind of makes indirect vision much harder is when you start using water. When you start using water with drilling.
Oh, I ran into that yesterday.
Huge difference. The mirrors are always getting wet and you can't see. But so that's something that I'm not quite sure how to handle yet. I'm still trying to figure that out. But yeah, my mirror skills have gotten better. My hand skills have. My composites. I mean, everything's getting better. Still not, obviously we're not where we want to be. I mean, we keep on trying to get better. I mean, my composites don't look perfect yet, but I mean, it's a work in progress, and it's nice to see some progress.
Definitely.
Yeah, I would say the same thing. I would agree. Just, it's like my indirect vision has been like, man, I've, like, the first time that I was like, whoa, what am I doing? Like, do I move my right hand this way? Like, what am I doing with my hands? I nick the tooth, I puncture like the gums and everything. Like, what am I doing? But it's significantly much better how much practice we have, and like, wow, what, like, I don't even have to think about it anymore. It's like, it's crazy the first time. But like, to your point, Seth, like, now we're just throwing another factor, water. Like, we never did that. It's like, it's a step-by-step approach of how we're like, we repetition. Oh, we've hit level 1. Now let's go to level 2 in a sense. Yeah. Like, we're building our skills, which is kind of cool and frustrating at times. A little bit like, oh, water, what the heck? Like, I don't know what I'm doing. Like, I can't see anything. Like, so it's definitely interesting and hard, and it's dental school.
Yeah, absolutely. Each year is going to have its own challenges, whether it's, didactic and kind of lecture wise, or if it's going to be clinic wise. And, our third year is going to be focused on boards and starting to see our first patients. And so every year is going to have its own challenge. So it's really is important to, as we've talked about already, to have this routine that's going to get you through every single day, and be productive, and, to try not to compare yourself, to other students. It's more like Seth said, compare yourself, to yourself, watch yourself improve, like we all have, whether that's, whatever improvement may be. We're seeing, ourselves improve and get better, and we want to continue to strive to do that. So I think that's great points that we brought up this episode, is just to focus on those things while you're going through dental school, and you're going to have a lot better of an experience. You're going to learn a lot more, and you're not going to be as stressed about like what other people are doing. You can learn from other people and ask other students, hey, go find that student that always seems to have a great crown prep and say, hey, what are you doing? Can I watch you do this? Or, but don't beat yourself up about it. Make sure that you are improving on whatever you're doing that day, every single day. So yeah, I think we did an awesome job this episode, guys. So thanks. I think we're going to start wrapping it up here, but I put Seth on the spot when I had him on. So Kyle, I'm going to put you on the spot. Do you have any other advice for either pre-dental students looking to get into school or dental students that are going through school right now? What advice or what pointers or tips and tricks, you don't have to do a ton, but like what are one or two that you have that you think students would find beneficial?
I mean, first off the bat, like your grades and your DAT, that's kind of like the major kind of metrics that dental schools look at. So kind of obviously keep those up, prepare as much as possible, the DAT and your academic grades, of course, and grind it out for sure. Those are the biggest takeaways, because obviously if you have a higher score there, you're going to have a higher chance of getting in dental school, because dental school wants to see if you could act like we talked about all these didactics, how hard it is in dental school sometimes. And they want to see if you could actually keep up with this, if you could have the science knowledge to keep up with this foundation and so forth. So grades and DAT is one thing I would say, just purely metrics wise and getting into dental school. But anything else, I would say just experience, shadow a ton, get immersed into the dental field and kind of get an idea of what you like and don't like, and just be involved around dentistry, so you can know when you get into dental school, like, oh, what kind of procedures we like to see, and start like meander your way towards like professors and so forth, just to kind of get an idea of what you want to do coming into dental schools. Because I didn't really know too much per se. I shadow quite a bit, but like we didn't really know too much. And if you get starting to build a foundation of what dentistry actually is and what it entails, it'll help you a lot.
Well said. Seth, do you have anything to add, or you good?
I would just say, I guess, to your listeners, I mean, if you're listening to this channel, you clearly are putting the effort and the time to investigate and to build your knowledge about dentistry, and that's such a great thing to do. I mean, and that's very key. And I think that if you're doing this, and you're on the right track, clearly. So let's just keep it up.
Yeah, absolutely. And when you have time, I know all of us, listeners, whether you're pre-dental students or dental students, like time is limited. I get that. We're going through school. We got a lot of stuff to do. But if you have some extra time to listen to podcasts, read books, attend CE events, anything that can help further your understanding of the field of dentistry is going to go a really long way. So just always be hungry to learn more, and especially be hungry to learn more outside of dental school, because I think, especially things like the business side of dentistry, like that's huge, that we don't necessarily get a lot in dental school. So the more you can learn about that while you're going through dental school, outside of school, the better off you'll be when you start your practice. So, yeah, absolutely. So guys, I think we're going to wrap it up here. Kyle, thanks for being on the show, man. I really appreciate, you being on the show. You did it. We got your first episode out of the way.
I know. I was waiting for you to get that info, and I'm so happy you invited me, Brandon. Thank you so much. All listeners and Seth for coming on the show too as well.
Hey, absolutely. And Seth, thanks for being on again. I really always, love chatting with you guys and love going through dental school with you guys. So it's been a great ride, and this is not the only appearances you guys will make on this podcast for sure. We'll have you guys on again, soon to talk about what other, whatever shenanigans are going on at the time. So, so thanks guys. Thank you, Seth, and thank you, Kyle, for being on the show.
Yeah, thank you.
Thank you. Peace.